If you're thinking about starting testosterone replacement therapy, pause for a second, because this might be the most important video you watch before you make that decision. TRT is everywhere right now. Clinics are advertising it, influencers are promoting it, and men in their 30s and 40s are lining up for prescriptions. But nearly no one is talking about what comes after you start. In this video, I'm going to walk you through the 5 real reasons not to start TRT and the types of men who should absolutely think twice before committing to it. And the 5th reason is the one that most guys only realize once they're already on it and trying to come off. The first thing to understand is that TRT is not a pill, it's an ongoing injection protocol and a long-term commitment. Most testosterone therapy is done through weekly injections or sometimes twice up to 3 times a week, depending on the dosing strategy. This means needles, prescriptions, syringes, refills, and a lot of planning when it comes to travel. Once you're used to it, the process isn't too difficult, but it is a routine you now have to maintain. Consistency really matters once you start. You can't miss doses. You can't just be doing it randomly. If doses are missed or delayed, testosterone levels will fluctuate, and that can show up as changes in mood, energy, and specifically mental clarity. There's also the monitoring side of things through blood work. Any responsible TRT program requires blood work every 3 to 6 months. We're watching markers like hematocrit, cholesterol, liver enzymes, estrogen levels, and overall hormone balance. We also need to know, how are you feeling? So if you're someone who dislikes needles, hates routine blood work, or you struggle with long-term structure, this is something to really think about here. TRT works best when it's managed carefully, and this does require some effort on your part, working with your primary care doctor. The second thing to understand is that TRT is usually a long-term decision. Once you start introducing exogenous or external testosterone, your body will start to reduce the amount of production within. So your brain senses that your testosterone levels are high and it stops sending signals to the testes to make more. So this feedback loop gets shut off. This happens through suppression of LH and FSH, which are 2 signals from the brain that communicate with your testicles. Over time, natural production can drop significantly. That's why TRT is not really a short-term experiment. It's not just take it for a few months, feel better, and then come off it, because you're literally crushing your natural production by going on it. So coming off can be challenging. Some men experience a period where energy drops, mood dips, libido declines, and overall motivation will feel way lower than before. Your body has to restart its own hormone signaling again, and that doesn't always happen quickly. I do help a lot of guys with this though, because there are reasons to start it and then come off it. But fertility can also be affected because of this LH and FSH drop. And then you're going to be dealing with less sperm quality, whether it's motility or morphology. So if fertility is important in the near future and you might want to have kids, that needs to be part of the conversation before starting this therapy. So the key takeaway here is pretty simple. TRT is usually a multi-year commitment. It's not just a short-term or trial run. And if your family planning in the next few years, that needs to be considered. The third thing to understand is that testosterone can influence several cardiovascular markers. This is not talked about a lot. Testosterone can increase red blood cell production and overall thickness. That's one reason historically athletes would use it for performance. But if red blood cells increase too much, hematocrit can rise, the blood becomes thick, and then your heart has to pump more like a syrup-like consistency around instead of more like a water-like consistency. And this is really hard on the heart and pumping mechanisms. So if that becomes thicker, more viscous, this can increase cardiovascular strain, more blood pressure, chances for clots and strokes. And in those cases, therapeutic blood donations is sometimes recommended to bring these levels down. I will routinely spot this in labs with my male patients and say, you need to do some blood donation to bring the thickness down. Lipids and cholesterol can also shift. We'll sometimes see LDL cholesterol. It may rise in some men, which is considered the bad cholesterol. HDL can decrease, which is protective. So you see kind of this swap that's not ideal with TRT use. Blood pressure can also increase in certain individuals. So we need to keep an eye on all this. And another big one, hair loss can accelerate in men who already have a strong genetic predisposition. Now, none of these happen to everyone, but they are all possibilities and things that we routinely need to keep an eye on. This is why proper monitoring is crucial. TRT should never be something that gets prescribed and then ignored. You need to have routine monitoring at least 1 to 2 times a year at minimum, sometimes quarterly as advised if we're tracking certain things. So this requires ongoing labs with a physician who's actually paying attention to these details and not just checking your testosterone and nothing else, okay? And of course, your lifestyle matters as well. It's not just like plug testosterone into a broken system and expect miracles. This is where training, nutrition, sleep, cardiovascular health are all still the foundation of the plan to make sure you're looking after and not just shooting something and expecting miracles. So testosterone does not replace the foundational lifestyle stuff. The fourth thing to understand is that TRT doesn't always fix the root cause of low testosterone. A lot of men show up with fatigue, low motivation, reduced libido, and difficulty building muscle. So they automatically assume that it's all because of low testosterone. And while those are signs of low testosterone, there can be other things going on. And sometimes you need to look deeper. Or say the testosterone does come back low. Why don't we discover maybe why that is? What are some of the causes for that before we just plug testosterone into the system? So we look at other drivers behind these symptoms. Poor sleep is a huge one. Even a few nights of disrupted sleep can lower testosterone levels. Should be highest in the morning and then fade as the day goes, but wreck sleep will cause low testosterone. Chronic stress is another one. I like to check cortisol levels in people. Cortisol levels in the morning, if they're too high, suppresses and crushes testosterone. Insulin resistance can also play a role. High insulin, low testosterone. Alcohol use will also trash testosterone. People are like, I want to have high testosterone, then they're out drinking on the weekends. So alcohol use matters a lot more than people think. Overtraining is another thing I explore with people. Too much exercise or too little will drop testosterone, as well as under eating and under recovering. So you need calories and recovery and sleep and proper cortisol management. Otherwise, all this will tinker with your testosterone levels. Another popular and common one is thyroid dysfunction. So this is responsible for your metabolism and it can mimic low testosterone. If your thyroid's slow, you are now not going to be able to output as much testosterone. So that may be a cause. And before putting testosterone in the system, fix the thyroid, okay? So when you improve all of those things I just mentioned, whether it's sleep, getting the alcohol out, cutting out marijuana, making sure you recover, eat enough calories, control your stress, sometimes that alone will solve this low testosterone thing, and then you're not plugging testosterone into a broken system. And the fifth thing to understand is that testosterone tends to amplify the system you already have. So if someone is well recovered, metabolically healthy, training consistently, TRT can feel incredible. Energy will go up, strength will go up, mood will improve, recovery improves, performance at work, just be a better, happier person to be around. All that you'll see as a net positive. But if someone is sleep deprived, chronically stressed, inflamed, overweight, testosterone can really magnify instability and it might not fix things. Or maybe you feel better for a few months and then all of a sudden down the road, you just kind of relapse back. So you might see irritability, estrogen fluctuations. That's a big one. You know, lots of body fat, and then you plug testosterone into the system, it's going to throw off a ton of estrogen. So this is important. Fluid retention may ensue. Anxiety and mental health. I've seen a lot of guys stir their systems up by not dialing the dose, or we have a broken system that we haven't fixed. Okay. Libido can kind of wax and wane. So these are all clues that something else is off. And so you got to treat the whole body. The environment and the hormones are entering into, if it's dysregulated, it's going to backfire at some point. Okay. So hormones don't operate in isolation. There's a lot of crosstalk going on between all these systems. The hormones interact with sleep, metabolism, your inflammation, your nervous system. All of this stuff matters, okay? So when the foundations are weak, adding testosterone doesn't always create the exact outcome you're looking for. And then people just go, okay, I'll just dose more. And then all those side effects we talked about earlier, thick blood pressure, cholesterol problems, it just starts throwing that even more out of balance. So be careful. There's also one additional point worth mentioning. Some men are being told that low testosterone may not actually be low. Reference ranges vary widely between labs, and it does take someone who knows this stuff to interpret it properly. Quite often in Canada here, the range is 8 to 28. And I know in the US it goes, maybe 300 to 1100, and people can be caught mid or low normal and told they're totally fine, okay? So you want to make sure that you get your total testosterone, your free testosterone, your SHBG. All of these things play a role, okay? Because two men can have the same total testosterone levels but feel very different based on how, their estrogen, their SHBG are operating within their system. Because if that testosterone cannot get to the cellular level where it needs to, it doesn't necessarily matter what's floating around. So interpreting labs here is a super, super important part of it. And many doctors are lazy with this. Hormone optimization should always start with a full assessment, not just a single number. So there's a lot of things we like to look at. Back to the cortisol, the insulin, vitamin D deficiencies can drive a lot of hormone imbalances because vitamin D is a pro-hormone. So all this stuff needs to be looked at. So to be clear, testosterone therapy can be extremely beneficial when it's used appropriately. If someone has optimized sleep, they're lifting regularly, body composition's good, low body fat and nutrition is dialed, and their testosterone is still low with clear symptoms, TRT can be a powerful intervention. Their energy will go up, their strength will improve, recovery is better, sleep is better, relationships, quality of life, all that will improve. But again, it goes back to having a dialed system, not just rushing to TRT because that one marker showed us low. Consider the lifestyle impacts and how you're living. So it should be a thoughtful medical decision with someone that knows what they're doing, not just a shortcut. You understand all the realities of what you're about to embark on. This will help you decide whether it's actually the right move for you. And in the next video, I'm going to walk through 5 ways to boost your free testosterone before considering TRT. I've also done another video on this. If you want to click and watch that, I'll link it in the show notes below. And as always, thank you for watching.